Hello everyone, this is Dr. Debé. Thank you for attending the webinar, Hypothyroidism Diagnosis and Natural Treatment. I'm a Board Certified Nutritionist. I practice in Great Neck, New York, and I consult with people in other states and countries via the internet. The subject we're talking about tonight is a very important subject. A lot of people are walking around not feeling well because of an undiagnosed underactive thyroid. And also there are people who have been diagnosed who aren't receiving optimal treatment. Conventional medicine usually just uses hormone replacement when a person is diagnosed with hypothyroidism. Conventional medicine doesn't consider that there are underlying causes that can be investigated and dealt with. The thyroid is part of the endocrine system. It's a gland in the neck that secretes hormones into the blood that affect the activity of other organs in the body. There are a number of thyroid hormones. When we're talking about hypothyroidism, we're talking about T4 and T3, those hormones primarily. Thyroid hormone has several important effects. It increases the rate of chemical reactions in the body, and it contributes to formation of heat, body temperature. Hypothyroidism is like the tip of an iceberg. The important thing is what's below the surface. Conventional medicine doesn't usually consider what's below the surface, what's causing it. In general terms, what's causing it is altered physiology. Things aren't working properly. And that's a result of genetics interacting with factors that we have some control over. Toxicity. Anything that builds up in the body beyond a certain concentration becomes toxic. Environmental chemicals, waste products from bacteria and other organisms in the intestinal tract, mercury from silver fillings in the teeth, medications, our own hormones and other chemicals at some level become toxic. Stress. For some people, stress is the biggest factor. And these different factors I'm going through have different importance in different cases. So we can have two people who are diagnosed with hypothyroidism, and for one person, toxicity might be the most important issue. For another person, toxicity is not important at all, but stress is the main issue. Often for a lot of people, there are a number of factors that interact to produce the underactive thyroid. Food allergy can be a big factor. Both inherited genetic intolerances to food, like gluten, and acquired food sensitivity reactions. Nutrient deficiencies. We all have unique nutritional needs, and if those aren't being met, hypothyroidism can be the result. Thyroid hormone is made from nutrients we consume. It's made of tyrosine, an amino acid, and iodine, a mineral. Imbalance of other hormones can have a negative impact on thyroid function. Some of the common findings in hypothyroidism are fatigue, depression, constipation, low body temperature, feeling cold, muscle cramps, increased LDL, bad cholesterol, arthritis pain, and neurological symptoms like a slow Achilles tendon reflex on neurological testing. Here's a quote from the Environmental Protection Agency. Numerous environmental agents have been reported to alter thyroid hormone levels in humans, wildlife animals, and laboratory and animal models. Typically, hypothyroidism is the consequence of exposure to environmental chemicals. Now, if you've been diagnosed with hypothyroidism, let me ask you, has your medical doctor discussed with you the possibility of environmental chemicals being the cause? Hypothyroidism involves more than the thyroid gland. A lot of cases of hypothyroidism don't directly involve the thyroid gland itself. The bottom line with hypothyroidism is that you don't have sufficient thyroid hormone activity at the cell level. So thyroid hormone tells cells to produce more energy, to work faster, produce heat. Thyroid hormones bind to receptors on the nucleus of cells and activate different genes to do their job. That's where the action takes place with thyroid hormone. It's not actually in the gland itself. Thyroid hormone metabolism starts in the brain. Part of the brain called the hypothalamus makes a hormone, TRH, thyrotropin-releasing hormone. That tells your pituitary gland to make TSH, thyroid-stimulating hormone. Thyroid-stimulating hormone tells your thyroid gland to take up iodine, make hormone, and secrete it into the blood. The hormone that your thyroid makes is primarily T4. It makes a little bit of T3 as well. T3 is more powerful hormone. Most of the T3 in your body is not made in the thyroid gland. It's made from T4 outside the thyroid, primarily in the kidneys and liver. And this quote over here on the left from the EPA tells us that every step in thyroid hormone metabolism can be inhibited by environmental toxins. This is T4, thyroid hormone. It's made up of tyrosine and iodine molecules. Your body takes off an iodine molecule at this position, and then you have T3. T3 is more powerful than T4. The conversion of T4 to T3 requires selenium. So as far as nutrition goes, we've already talked about an amino acid, tyrosine, a mineral, iodine. Now we're talking about another mineral, selenium. So if you're lacking in tyrosine, iodine, or selenium, that could result in low thyroid function. It is estimated that 5 to 7 times as many nuclear receptors must be occupied by T4 to create the same physiologic effect as T3. So T4 is not as potent as T3. T3 is much more potent than T4. Our T3 is reverse T3. This is an inhibitor of thyroid activity. Reverse T3 binds to the same receptors as T3, but it only exerts 1/100th the activity of T4, whereas the T3 is 500 to 700% more potent than T4. So if you have a lot of reverse T3, that's going to result in low thyroid function. T3 is the accelerator, reverse T3 is the brakes on metabolism. So your body makes reverse T3 to slow down your metabolism. And it does that for beneficial effects in certain situations. You know, but when somebody is in a serious metabolic crisis, you know, after a severe burn, for instance, it's good to not have the metabolism rev up too high. The body makes a lot of reverse T3 to slow things down. This is T3. This is reverse T3. The iodine is removed at a different location on thyroid hormone on T4, and it makes all the difference in activity in the body. Approximately 80% of T4 is converted into equal amounts of T3 and reverse T3. For your body to make T3, you need selenium. Your body doesn't need selenium to make the reverse T3. T3 conversion from T4 is inhibited by the stress hormone cortisol. Cortisol increases the conversion of T4 into reverse T3. So cortisol is not good for thyroid hormone metabolism. Elevated cortisol can result in hypothyroidism. Formation of T3 from T4 and the degradation of reverse T3 both require 5' deiodinase. This is a selenium-dependent enzyme. So you need selenium to make the active T3. You also need selenium to detoxify reverse T3. Iodine is in the same chemical family as fluoride, chlorine, and bromide. These chemicals displace iodine in the body. They can displace iodine in thyroid hormone and result in low thyroid activity. They can impair the uptake of iodine into the thyroid gland. And these chemicals are found in so many places. They're all throughout the environment. They're in our food and in air and water and medications and all kinds of household products we use, Scotchgard and Armor All and Teflon pans. We're exposed to these things in so many places. Heavy metals also impair thyroid hormone metabolism. Mercury, lead, and cadmium impair the conversion of T4 into T3. So anybody with low T3 should be evaluated for heavy metal toxicity. The conversion of T4 into T3 takes place in the liver and kidneys, so if you have a problem with your liver or your kidneys, that could be a factor in your hypothyroidism. Another factor in thyroid hormone activity is your acid-base balance, your pH. If your body is too acid, the thyroid hormone doesn't work as well. It may take twice as much of the same hormone when your body is acid compared to when you have an optimal pH to get the same effect. People can measure their pH with some meaning by checking the first morning urine. You get some pH paper with a range of 5.5 to 8.0, and when you get up and urinate the first time for the day, you dip the paper into the urine midstream, see what color it turns, match it to the chart that comes with the pH paper, and you want your pH to be between about 6.6 and 7.2. If it's under 6.6, your body's too acid. In addition to selenium, zinc is another important mineral for thyroid hormone metabolism. Vitamins A and D are important for a number of reasons. They play a role in thyroid hormone activating the receptor inside the cell to activate genes. So we see there are more and more nutrients important for your thyroid to work properly. This is a summary slide of different things that go wrong in different areas in the body related to thyroid hormone metabolism. So in the upper left, pre-thyroid, involving the brain, the thyrotropin releasing hormone, and TSH, thyroid stimulating hormone. Stress, high cortisol levels can impair TRH and TSH output. Toxicity also impairs these hormones. In the thyroid gland itself, iodine deficiency. And iodine deficiency is very common in this country. Years ago, iodine used to be added to grains, and it's been replaced with bromine, and that's replacing a positive with a negative. Best source of iodine is probably seaweed. We get a little bit of iodine in egg yolks. A lot of people would be better off if they supplemented with some iodine. Gluten can impair the functioning of the thyroid gland in susceptible people, possibly certain goitrogens. There are chemicals in some foods that can impair formation of thyroid hormones. You need a lot of these goitrogens to have a negative effect. Broccoli is one of the foods where you find these chemicals. If you steam broccoli for 3 minutes, it inactivates the chemicals that interfere with thyroid hormone metabolism. Pesticides and other environmental chemicals can impair thyroid hormone production. Autoimmunity, which we'll talk more about in a minute. Then once the thyroid hormone is produced, the delivery of the hormone to the cells can be interfered with. if you have too much thyroxine binding globulin, a protein in the blood that binds thyroid hormone, then the thyroid hormone can't leave the blood and go into the cells and have an effect. And one of the things that increases the thyroxine binding globulin is estrogen. So if a woman has high estrogen levels, or if she's taking oral contraceptives with high estrogen content, that can have the effect of producing an underactive thyroid. Impaired conversion of T4 to T3, and that can be due to selenium deficiency, heavy metal toxicity, low protein to carbohydrate ratio in the diet, stress, high cortisol levels, certain medications, including beta blockers, impair the conversion of T4 to T3. Then at the cell level, the thyroid activation of the cells can be impaired by the body being too acid, lacking omega-3 fatty acids, too much trans fatty acids, and deficiencies of vitamins A, D, EPA and DHA from fish oil, selenium. I've made a list of things I've come across in research that have an effect of possibly contributing to hypothyroidism. There's genetic predisposition, aging, stress, surgical or pharmaceutical treatment of hyperthyroidism, anorexia nervosa, fasting, malnutrition, nutrient insufficiencies, systemic illness, insulin resistance, the hormone insulin not working well, inflammation, autoimmunity, iron deficiency anemia, imbalance of other hormones including estrogen and progesterone, exposure to environmental pollutants and other toxins, physical trauma, smoking, radiation, some medications, inactivity, and certain foods. I don't want to spend time going through this in detail, but this is just a summary sheet of natural solutions to those different areas of dysfunction when it comes to thyroid metabolism. Now, if you've been told you have an underactive thyroid, you're hypothyroid, it's important to know if the condition is autoimmune. To your medical doctor may not make a difference. Your medical doctor probably won't do anything different if your condition is autoimmune. But there is a lot that can be done in addition if the condition is autoimmune. I certainly have additional things I do if we determine that the condition is autoimmune. These represent thyroid cells. Here comes a foreign invader, an E. coli bacterium, that causes your immune system to jump into action and produce antibodies to target the foreign invader for destruction. That's what your immune system is supposed to do. That's a good thing. Now, why doesn't your immune system attack you? Because there's something friendly about you. There's something that your immune system recognizes about you, that it's a friend. Your tissue is friendly. It shouldn't be attacked. But that can change. One thing that can cause a change is toxicity. Toxins can interact with and damage our tissues, change their structure, their appearance to the immune system, and then your immune system thinks that your tissue is something foreign that needs to be attacked. Toxicity is one of many things that can contribute to an autoimmune process. A lot of cases of hypothyroidism are autoimmune in nature, and that's determined by measuring antibodies in the blood. I just check off thyroid antibodies on my blood test form, and we get levels of thyroid peroxidase and antithyroglobulin antibody on blood tests. And if those levels are elevated, if either one is elevated, that's evidence that the immune system is attacking the thyroid gland. And, so it's really an immune problem. It's not a thyroid problem. The thyroid issue is secondary. The way to try and solve the problem is to stop the immune attack. And there's a lot to look into as far as causes for the autoimmunity. Toxicity is just one of many factors that contributes to autoimmunity. So I have an autoimmune program. I have a diet and supplement program for autoimmunity, kind of a core program I recommend for everyone. And then I recommend a lot of evaluation, a lot of specialized functional medicine lab tests to look for the different contributing factors. And we address those and personalize the program in each case. Okay, expanding a little bit on the toxicity. Dental amalgam as one of the risk factors in autoimmune diseases. Results imply that in some patients with thyroiditis, that's inflammation of the thyroid, an autoimmune condition of the thyroid gland, mercury from dental amalgam can stimulate the production of anti-nuclear antibodies. Dental amalgam may be a risk factor in some patients with autoimmune disease. So if you have silver fillings in your teeth, the mercury from the fillings leaches out, and it can contribute to an attack on your thyroid gland, producing low thyroid function. So just taking thyroid hormone is inadequate. You know, that's not getting to the underlying cause. Gluten is a big factor in autoimmune conditions. There's a 10-fold increase of thyroid autoimmunity in people with gluten sensitivity. Your body makes antibodies that attack gluten and cross-react with the thyroid gland. An unappreciated source of toxicity, body fat. This study, they had people go on a low-calorie diet, and they measured organochlorines or pesticides in the blood before and after the program, before and after weight loss. And this is the conclusion. Organochlorines released in plasma during weight loss are associated with the documented decrease in serum T3 concentration and resting metabolic rate. So this study found with weight loss, people had increased pesticides in the blood, reduced thyroid hormone levels, and reduced metabolic rate, so their bodies weren't burning as many calories. Not a healthy thing. So with this information and similar findings from other studies, it's important that when you go on a weight loss program, that it's well-structured, healthy, nutritious. You need nutrients to run the detoxification enzymes. You need amino acids largely to latch onto environmental toxins and drag them out of your body. So your nutritional program has to be well-designed in order to not suffer the effects of poisoning with fat loss. The title of this study was Associations Between Weight Loss-Induced Changes in Plasma Organochlorine Concentration, Serum T3 Concentration, and Resting Metabolic Rate. This is a test I do in the office that checks for signs of toxicity, a functional acuity contrast test. This is a visual test that can show signs of neurological toxicity. On that card, there are rows and columns of circles with lines that point in different directions. And the lines vary in intensity of gray. And it's been found that people with neurological toxicity can't see certain shades of gray. And this test has looked at, this test has been done in people suffering from many different types of toxic exposure, finding that it correlates well with neurological toxicity. So if you fail this test, then toxicity is likely a problem for you and could certainly be affecting the thyroid. The thyroid is very sensitive. This is the liver, and it's in the liver that LDL cholesterol is processed with the aid of T3. thyroid hormone. A lot of cases of high cholesterol are due to an underactive thyroid. Another thing that the thyroid does related to your blood vessel health is influence the size of the cholesterol particles. When you get a blood test and you get a measure of cholesterol in your blood, the units of measurement is milligrams per deciliter. That's weight per volume. That number is a result of the number and size of cholesterol particles in the blood. So we have cholesterol particles of differing size in the blood. Large cholesterol particles are good. Large particles kind of bounce off the artery wall. An underactive thyroid is one thing that contributes to cholesterol particles being small. When the cholesterol particles are small and dense, they don't bounce. They contribute to plaque buildup in the arteries. There's a special test that can be done to measure the size of the cholesterol particles. That's a test I do on anyone with elevated cholesterol or with cardiovascular risk factors, a family history of heart disease. One such profile is called a VAP profile. It's done by Quest Lab. And if you have the small, dense, or pattern B LDL cholesterol particles, that's something that needs to be corrected. Even if your total cholesterol is normal, if you had the small, dense particles, that puts you at increased risk for cardiovascular problems. A lot of doctors over-rely on blood tests in diagnosing hypothyroidism. What I do is I look at the symptoms, signs, and blood tests. Look at them all in combination. Sometimes I'll have someone who has a blood test that suggests less than optimal thyroid function. But when I question them, if they don't have the symptoms of hypothyroidism, I'm not concerned. On the other hand, if they have symptoms of hypothyroidism and the blood tests appear normal, then I'm still suspicious. The blood tests aren't always going to give us the truth when it comes to hypothyroidism. There are problems with thyroid hormone metabolism that you just don't see in a blood test. But there are ways to learn more through blood testing. Okay, before we get to that, these are symptoms related to an underactive thyroid. So I have people fill out an online questionnaire, a symptom questionnaire, and this is one section. This section has to do with underactive thyroid function. The whole questionnaire has to do with symptoms of different conditions. These are symptoms of an underactive thyroid. So symptoms are very important. If you have a lot of symptoms of an underactive thyroid, there's a very good chance you do have a problem with thyroid hormone metabolism. Body temperature is also important. On my website, drdebé.com, there's an article. If you click on the articles button, there's an article called Removing Metabolic Barriers to Weight Loss. And in the article, I describe a simple test you can do at home with a thermometer to measure your body temperature and see if it's too low. If it comes back low, that could be due to an underactive thyroid. And then there's additional information in the article to try and rule out other causes of the low body temperature. Thyroid hormone produces heat. So if your temperature is low, that's an indication you might have low body temperature. You might have low thyroid function. These are other signs of hypothyroidism. High total cholesterol, small dense LDL cholesterol particles we talked about, high blood pressure, excessive body weight and body fat in particular. You could have normal body weight, but with a bioimpedance analysis, a test I do in office that measures body composition, we can see elevated body fat with reduced muscle mass at the same time. So the total weight can be normal, but the composition is off. There's too much fat, not enough muscle. Edema or water retention, scalp, tongue, slow Achilles reflex return, dry skin and hair, thinning of the outer third of the eyebrows. Blood testing, high ratio of beta-carotene to vitamin A. You need thyroid hormone for the conversion of beta-carotene to vitamin A. And that high beta-carotene can be seen in some cases with yellowing of the palms of the hands and soles of the feet. So the test I mentioned a minute ago for measuring body composition is bioelectrical impedance analysis. We conclude that hypothyroidism is primarily accompanied by quantitative as well as qualitative changes in the body, while considerable fat increase is the most important feature of hypothyroidism. BIA, or bioimpedance analysis, could become a useful tool which allows objective determination of even subtle metabolic manifestations of thyroid disease and should therefore complement conventional clinical and biochemical assessment. So we can have two people who weigh the same, but the composition can be drastically different. This person has a lot of muscle, minimal amount of fat. This person who weighs the same, less muscle, a lot more fat. Doctor, if all my tests are normal, then why do I feel so bad? Judy, hasn't anyone told you that it is normal to feel bad? Laboratory test range are set up so 95 out of 100 people are going to fall within normal. 2.5% of people come back low, 2.5% of people come back high. Everyone else is normal. These reference ranges are set up by testing a number of average Americans. The average American is not all that healthy. So just because you're considered normal compared to the average American, there's nothing to brag about. So what I do is I use a more optimal, narrow, healthy reference range. We pick up more subtle problems. This is a laboratory's conventional reference range. This is a more narrow, healthy reference range. This is a computer program that I use. So I send people for what I call routine comprehensive lab tests. I take the numbers and plug them into this computer program. And this is a report that's generated. So I tested this individual for more things than are shown here. But these are the things that are in need of help. Things that are outside of the lab's range and or outside of the healthy reference range. So when we use the healthy range, we're going to pick up a lot more problems. TSH is probably the single hormone that's most relied upon to diagnose an underactive thyroid. When the TSH is high, that's when you have an indication of an underactive thyroid. TSH is thyroid stimulating hormone. TSH increases when the thyroid is not doing its job. It tries to get the thyroid to work harder to make hormone and secrete it. Laboratories typically have a upper limit on the TSH of 4.5 or 5.5. I use a cutoff of 2.5 with the healthy range. So if your TSH is 3, that's an indication to me that you probably have an underactive thyroid. It's within the lab's normal, but it's too high. And there's other hormones we look at. We look at T4 and T3. We look at the thyroid antibodies, and this individual has problems with all of those. We measure reverse T3. That's very important. Okay, here's a case study. A 36-year-old woman was very depressed. She was very cold, had cold intolerance. She had hair loss, heavy periods, 4 yeast infections in the past year. And on lab testing, her TSH was low. Her T4 and T7, that's another thyroid hormone test, these were low. Okay, the T4 and T7 tell us that thyroid is underactive. With an underactive thyroid, we'd usually expect to see an elevated TSH, the pituitary gland trying to get the thyroid gland to work harder. In her case, we didn't see it. In her case, her TSH was low. And that's telling us that her problem is not in the thyroid gland directly. Her problem is in the pituitary gland. She has an underactive pituitary gland that's resulting in a secondary hypothyroidism. So something is causing her pituitary to be underactive, and then that's resulting in low thyroid function and symptoms of an underactive thyroid. Toxicity and stress are a couple of the common factors that can contribute to an underactive pituitary. So part of her treatment involved some nutritional supplements, a thyroid supporting supplement called GTA, and a pituitary supporting supplement called Thyrostem, and she did great on these. On follow-up testing, her values improved, her hormones improved, came into the lab's normal range, and her symptoms improved. Okay, here's another case. When this woman came to see me, she was already diagnosed with hypothyroidism. Her symptoms included fatigue, cold hands and feet, brittle nails. She was anemic. She had abdominal fullness and discomfort, a lot of belching. I found out that her thyroid condition was autoimmune. She didn't know that when she came to see me. So her TSH, thyroid stimulating hormone, was high, showing underactive thyroid. And her thyroid hormone levels were okay by the lab standard, but they were below optimal. And I found that she had an elevated thyroglobulin antibody, showing that her condition was autoimmune. Her immune system was attacking the thyroid gland. So we looked for what could be triggering the immune system to attack the thyroid gland. Actually, some other parts of her lab test gave us some of the answers. Her basophils, type of white blood cell, were high, and those commonly elevate with parasites. So it made me suspicious that she had a parasitic infection. Her CRP, cardio-CRP, C-reactive protein, was high. This is, or above optimal. This is an inflammatory marker, so it told us that her body was in an inflammatory state that can contribute to hypothyroidism. Her ferritin, major iron storage protein, was low, so she was iron deficient. IgA antibodies, immunoglobulin A, against gliadin, protein you find in wheat, was high. So it's likely that gluten intolerance was contributing to her autoimmunity. Her homocysteine was above optimal. Homocysteine is an amino acid that requires a process called methylation to be detoxified. And if you have inadequate methylation, that allows for the expression of genes that contribute to autoimmunity. So we learned a lot from the computerized analysis of the routine blood tests, and then we did some additional testing. We did a stool test from Metametrics lab that uses DNA analysis to pick up the organisms in the intestinal tract. It's more sensitive than testing done anywhere else. And we found that she had a parasite. So the blood test made me suspicious she had a parasite, and we found she did indeed have a parasite. And we saw signs of inflammation from within the intestinal tract. Most of the immune system is clustered around the intestinal tract, so anytime there's an immune problem, it makes sense to look at what's going on inside the intestinal tract. It's not surprising that she had inflammation there. She had a parasite. She also has a gluten intolerance. Also in the stool specimen, we found the elevated antibody against gliadin, the protein fraction of gluten found in wheat and other grains. She also had signs of maldigestion of protein, and possibly due to inadequate hydrochloric acid production by the stomach. And she had signs of malabsorption, and possibly from the parasite or the gluten damaging the intestinal lining. We put her on a program, and 3 months later, her thyroid hormones came into normal range, and her thyroid antibodies normalized. Her homocysteine came into optimal range, and there's the thyroid antibody, normal. And of course, she was feeling better at the same time. And I didn't give her any what you would call thyroid-specific supplements. We dealt with these contributing factors, and the thyroid normalized, I think largely because the immune system wasn't attacking it anymore. Okay, this was a case of infertility. This woman had elevated thyroid antibodies, thyroid peroxidase and thyroglobulin antibodies, and we put her on a program. and they dropped dramatically in, was it like 5 months? So they still have ways to go, but they dropped quite a bit in a relatively short period of time. This is what my website looks like. A lot of you have probably seen it. There's a lot of information there. I have a few articles on the thyroid. I have an article on reviving your thyroid. It has a list of medications and environmental chemicals that are known to suppress thyroid function. You might go take a look for that article. You can do a search for reviving your thyroid and find that article. And there's other things I'm sure you'll find of interest. And you can view past webinars. If everything goes well, I'll be posting this webinar on the website. And you can check back to register for future webinars. And if you're not on my email list already, feel free to register for the newsletter, and you'll get my newsletter and announcements for webinars and seminars. My website again is drdebe.com, drdebe.com. And now I'll take any questions over on the right. You can type in questions, and I'll do my best to answer them. Okay, looks like we have a couple of questions already. Okay, there's a question about what's the connection between hypothyroidism and schizophrenia and what to do about it. Okay, good question. I don't think I've ever had that question posed to me before, but I think I could give you a little bit of useful information. If your thyroid is underactive, it can impair brain, mental, emotional functioning. The first sign of hypothyroidism is mood swings. Depression is a common finding with hypothyroidism. Difficulty concentrating. Other deficits in cognition. Not really schizophrenia per se, but mental emotional functioning could be improved by optimizing thyroid function. Now, something that can contribute to both cases, both conditions, hypothyroidism and schizophrenia, is gluten intolerance. I mentioned gluten intolerance contributes to autoimmune thyroid disease. It's a major contributor. And there are quite a few cases of schizophrenia that are produced in large part due to gluten intolerance. There are people who have complete remission of schizophrenia by going on a gluten-free diet. So that's the first thing I would look at, is the possibility of gluten sensitivity. There are lab tests for gluten sensitivity. Outside of New York State, you can get a test done by Cyrex Labs. They're located in Arizona, C-Y-R-E-X. You can look them up on the internet. I think it's probably cyrex.com. And they do a panel from the blood that's the best assessment for gluten sensitivity. They measure, I think, 12 different analytes in the blood related to gluten sensitivity. Other labs measure antibodies against one protein, alpha-gliadin. But gluten's actually composed of like 60 different proteins. Cyrex Labs measures about 12 of the most important proteins. So they're going to pick up more cases of gluten intolerance than anyone else. You can get that test done in every state but New York. And because of that, I started a petition to try and get lab tests allowed in New York, including the Cyrex lab tests. There are a lot of lab tests that we can't get in New York that are allowed everywhere else. There's a link to that from my website. If you go to the links page, there's a link to the online petition, or you can just type in freeourlabtests.org. That'll bring you to the online petition. You can sign it if you like to try and get these important lab tests available in New York. What we can do in New York related to gluten sensitivity is we measure it in the blood, we measure it in stool and saliva. The antibody shows up first in saliva. It can show up years before it shows up in the blood in the saliva. Stool is probably an intermediate test. So I have people who have a normal blood level, but we can pick up an elevated antibody in saliva or stool. And I also use an optimal reference range. So whereas the laboratory might say it's okay to have an antibody level up to 11 when you're measuring alpha-gliadin, the fraction of gluten, if it's above 5, that's highly suspicious to me. So anybody with schizophrenia and hypothyroidism, that's the first thing I would investigate is the gluten. You could also just try a strict gluten-free diet to start with, but if you need some motivation to accomplish that, you have a test to confirm that you do have a gluten sensitivity. I would recommend a thorough functional medicine workup in addition to the gluten. I would look at other sources of toxicity, heavy metals, and other environmental toxins, nutrient deficiencies, stress hormones, and other hormones, and correct whatever abnormalities show up. Okay, I think that was the only question. I'll give it another minute if anybody would like to type in another question. I'd like to thank you all for attending. I hope the information was useful, and I hope you attend a future webinar. And if you think of questions later on, you could email us to me. You could go to my website and just type a question from the website as well. Okay, thank you, everyone. Have a good night.